We have set out to have a program here where any of us who work here would feel comfortable being transplanted ourselves. It doesn't matter who the competition is. If you wouldn't go there for your own treatment, why would you send a patient there? And I felt comfortable from the beginning that the care that we give here is second to none. And I think that that's really the standard of what we do and what we want to do. It doesn't matter who the competition is to me. If we're not doing the job that we should be doing, we won't do it. And I think that it doesn't matter whether someone down the street or around the block or elsewhere in the country is doing it differently. If we feel what we're doing is state of the art and the best job we can, and we would send our family members or ourselves to a place like this, that's good enough. I've done this because I believe in the procedure. I mean, it was been a part of my training ever since I was a hematologist, and so it's something that I've always found fascinating and interesting and worthwhile to do. As a side benefit for me, I get to meet some pretty amazing patients, and that's always been the generator for me for getting up in the morning and not going to bed at night. But I think that I am constantly impressed with the courage of our patients and the ability to take chances to get better, and the families and the support that they have makes it worthwhile for all of us. It's hard work. It's harder work for them, but it's hard work for all of us. And I think it's an important thing to remember when things aren't going so well. Sometimes that that we do good things. It's the irony of this business that the better patients do, the less often I see them. And so what you tend to have is a lot of people who are really sick that you see a lot, and the people that are well are out living their lives, which is the way it should be. But I think it's important to take pleasure in the successes as well as understand the limitations of what you do. And I'm constantly aware of the latter. I think it's sometimes hard to remember the good that you do because people are out there living their lives. But it is always good for us to see people who bring children in that were born shortly before their transplant who are now going to college.
Yeah.
And that kind of satisfaction is something that you just can't buy otherwise. So it's an important part of what we do, but patients have always been the first part of what makes me do what I do. And I think it motivates everybody on the team. It doesn't matter whether people never lay eyes on a patient, whether they're data managers or people that are processing the cells. I mean, if the only contact with the patient is their stem cells, people are still motivated to do the best job they can because they know, just like I do, that every part of this is important and none of us is any better than the weakest part of what we do.